So over the last 24 hours, we had 17 new cases. Currently, we're tracking 125 cases. We have in our hospitals 8 persons, 5 of whom are in the Ocean View Hospital, and currently we don't have anybody in the ICU. In terms of vaccines, first dose, 18 years and over, we have administered 446,492 doses. That's approximately 87% of the population. Second dose, we are now at 346,315 doses, or approximately 67.5% of that population. We have been administering vaccines for the 12 to 17, and first dose, we have been able to administer 35,703 doses. That's approximately 49% of that age cohort. Second dose is now at 26,192 doses, or 35.9% of that age cohort. In terms of the 5 to 11 age groups, we have administered 8,156 doses, or about 8% of that age cohort, and second dose is now at 3,940, or 3.9% of that age cohort. Boosters right now are at 73,489 doses. So the new booster that both Pfizer and Moderna is working on and is really what is called a biphasic booster, because on the way that these things work, the immune system would recognize the spike protein on the virus. So these mRNA vaccines were engineered to present parts of the spike protein to our immune system. So if our immune system recognizes that, they can build antibodies against the virus without us having the infection. But the vaccines that Pfizer had previously produced were based on the original strain of the virus. And with mutations that have occurred over time, the spike protein has changed. So what they're trying to do is to make sure that you have a part of the ancestral strain, meaning the original type of the virus, plus a piece of the current strains that are circulating. And by presenting that to our immune system, we should have better immunity against the circulating strain. So on that hypothetical basis, they have now manufactured these types of vaccines, and these vaccines would now be given to the public. So the US FDA would have cleared it a couple of weeks ago, and so this is now going to be implemented in the US. Later on, we'll see whether or not we'll be able to have access to these types of vaccines. So we want to promote wellness. I think most people come to the institutions of the ministry when they're sick. So they have some form of illness. Well, we want people to come when they're well as well. So basically what we're trying to do is to teach people the right habits. So one, we want people to be exercising. So we want to demonstrate to people the importance of exercise. What you eat is also very important. And so we want to get people to understand the right types of foods to eat, not the quantity, but the quality of the food that you eat. It must be nutritious, have the vitamins and so forth. So there will be a section that deals with nutrition. I think they will be doing some demonstrations on how to prepare healthy meals. And you would know some persons with disease conditions such as diabetes might require a special diet, so they'll be able to explain those things to persons who would come. In addition to that, sleep is also important. I don't think a lot of people realize how important sleep is. So we want to talk about that some more. We also want to talk about how you de-stress, preventing stress. And that's also important because a lot of people face anxieties, and some of them would have mental illnesses that would go undetected. And therefore, if you want to avoid these anxieties and depression, we need to come up with ways of detecting it early. So a part of what we'll be doing at the fair, we'll be talking about mental wellness as part of the fair. So there are different components. I think persons, once they come, they would find a lot of interesting information, things probably that they didn't know about. But if they take the information, apply it, change their behaviors, then obviously they will be able to live longer, healthier lives, which is the aim of the fair. Well, we have been able to diagnose and treat these two patients successfully. I think the importance here is that we have to remain vigilant. So persons, if they have any rashes and they're uncertain about the rashes, then they should contact our health system so that our doctors can be able to examine them and make that determination whether it's a rash from some other disease or if it's a rash from monkeypox. We can also confirm that with laboratory diagnosis, and therefore we would be able to help that patient quite quickly. So I think precautions are very important. So anybody reporting a rash, we'll want to, take it very seriously. We have a hotline, so persons can contact that hotline, and we have a response team that would be able to come out and respond to the patient's needs. So if we all play our part, I think we can, reduce the cases of monkeypox that we have in the country. Globally, the monkeypox has been on a decline, but it's not over as yet. So we would have to make sure that we continue to monitor here, have strict surveillance, and I think over time we'll see a reduction in cases globally, and it would not become that great of a threat around the world. But we're still perhaps several months away from that.